Hi there, this is Dr. Ajaya Kashyap, and today we'll be talking about arm lift surgery or brachioplasty. It's a common procedure that I do. I have a few common questions that people ask, and I'll go over each one of them. The first question is, what is it? People will come with, loose hanging skin from their hands, on their arms, upper arms, or they would have a lot of fat with also excess skin on the upper arms. And this is the problem that the brachioplasty or arm lift addresses. Now, it can do it surgically with less surgery, with limited incisions, or with a full incision to correct as much laxity as it can, depending on the acceptability of the incision, the scarring, as well as the amount of improvement needed. The second question is, who's a good candidate? A good candidate for a brachioplasty is someone who has either lost a lot of weight or with age has a lot of skin laxity. The skin kind of hangs down. Or if someone has a lot of fat, the skin may not be loose as of now, but once the fat is removed with liposuction or some other means, the skin would start hanging. So essentially, it is loose hanging skin, whether it is now or after liposuction or other means of fat removal. So a good candidate is one who has this condition, but at the same time is in good health otherwise. Now, how is it performed? It is basically a surgical procedure, but I'll go with the various options that one may have, going from the least to the most aggressive approach. The least would be a brachioplasty would be, you can do a liposuction of the arm, get rid of the fat, do a skin tightening method like a thermitite or body tight, and kind of do a little bit of tightening with this invasive radio frequency techniques. So that is one way of doing a non-surgical or invasive but non-really surgical, non-incisional brachioplasty. The more common one is doing a brachioplasty surgically, which means having a cut. Either the smallest cut would be in the axilla, just pulling the arm up like this, the loose skin up. The second would be a limited, like a T or an L incision, where one cut is in the axilla, in the armpit, the it on the arm, the upper arm. And then there would be the full brachioplasty with a long incision, which means the cut goes from all the way from the armpit down to the elbow, or even a little bit into the just above the forearm. So those are the extents of the brachioplasty, and the way we kind of assess it is by seeing how much of extra fat is there, how much of extra skin would be resulting after the fat is removed, or if there is just excess skin, to what extent the excess skin is there. We also talk to the individual and kind of discuss about the scarring and how much scarring would be acceptable. Some people want to have really tight skin, and the scarring they can take care of, have tattoos or something, but they want to have as much tightness as possible. Now other people say that we at least want to be comfortable wearing half sleeves, and if the scar can be limited up to halfway down the upper arm, that would be more acceptable. And depending on if the skin laxity is more on the upper half, this can be done. Surgical performance of brachioplasty is usually done under general anesthesia. It can be done under local anesthesia or sedation, but general anesthesia is usually preferable and more comfortable. The procedure itself takes a couple of hours, including both sides. Very often, what I do is a liposuction through two small cuts, which would be incorporated in the brachioplasty incision, and so that there is no additional scarring. So I take two small cuts, do a lot of liposuction, and then remove the extra skin. I do not try to cut too much of the fat off with the skin, because just deep to the fat, there are some fine nerves which supply sensation to the arm and the forearm and so on. So to avoid damage to those nerves, it is best to try and remove most of the fat with liposuction alone, and remove very little, if any, with the skin excision. So an ellipse of the skin is removed, or whatever shape is required depending on the laxity, and the incision can be placed either in the back part or in the groove here. So that is the two placements of the incision depending on how much loose skin is there, and again the acceptability of the scar. Some people don't want any scar to show when they lift things up like this, and some don't want to show it from the sides. So depending on where they find it acceptable, we discuss with the individual who's getting it done and make a decision. The other question that I'm commonly asked is, what is the recovery period? Now, the recovery in terms of going up and around, one can be up and around the same day of the procedure. The only thing we kind of explain to people is that when you're up and around, when you're getting up from a laying down or sitting down position, do not put pressure on your arms. So just be careful with that. Other than that, you should be walking around the same day. Um, you can work with the computer, with your phone the same day. Otherwise, other regular activities, we usually say 2 weeks. In terms of heavy weight lifting, some excessive hand movements or arm movements, um, for that I think 6 weeks would be the best time. And at 6 weeks, we often tell people to actually do some exercises with the biceps and the triceps gently, so that the shape can improve further. The next question is, will there be scars after brachioplasty? And with an arm lift, you will always get scars unless you do a non-surgical kind of brachioplasty, which I explained. That is done with needles, but the effect of that is limited. If you want a full effect, you would have to do a surgical brachioplasty, and for that there will be scars. Now we try to limit the scars, we try to keep them as small as possible, but if the laxity of the skin goes all the way up to the elbow, the scars will have to go down to that level as well. So yes, there will be scars, and everyone scars differently, but some people cover the scars with tattoos, other people have fractionated lasers or other lasers to improve the scarring, and there are some treatments often needed to keep the scar as fine as possible. The other question I'm asked is, can you combine them with other procedures? And most often it can be combined with other procedures. I often combine arm lift with breast or chest procedures for men, gynecomastia, or other skin tightening procedures. Sometimes even non-surgical procedures can be combined. So as long as the procedures are not too extensive, one can combine those with the brachioplasty. The other question is, does insurance cover it? And the insurance usually does not cover these cosmetic procedures. You can ask your insurance to see if it would cover any part of the procedure, and you can explain to the insurance that you have weight loss and you have issues and so on. But in general, it is not something that the insurance would cover. The other question is, how long does it last? The improvement, how long does it last? So it is like this becoming your new baseline. The aging and the other processes will continue, but this becomes your baseline. So the short answer is many, many years, unless there's a huge fluctuation in your weight. The other question people sometimes ask, and it's not of me because I'm a plastic surgeon who does these things frequently, is how to find the right kind of surgeon. So you look at their qualification, look at where they've trained from, look at what the other procedures they do, how much of these kind of procedures they do every year, and how long have they been doing them. So once you are happy with those answers, then you can actually meet the surgeon and discuss how he or she does them. And if you're convinced, absolutely go ahead with it, if that is what you need and if that is what is indicated for your problems. If you have any other questions from us that we can answer, that we can help you with, please feel free to contact us on any of the numbers given below, or even contact us on our email address which we have given. Thank you very much and have a wonderful day.